My name is Chantel.
My name is Jessica.
My name is Karen.
My name is Natalie.
My name is Karen.
And I'm a forensic nurse.
Within forensic nursing, my subspecialty is an advanced forensic nurse examiner.
My area of practice is legal and risk management.
Emergency medicine and correctional nursing.
My area of specialty is quality improvement.
Within forensic nursing, my area of practice will be in sexual assault medical forensic examination.
Forensic nursing is a specialty that involves nursing anytime healthcare and the legal system intersect. So a patient is in need of healthcare because they are a victim, suspect, or perpetrator of either trauma, violence, or maltreatment. And because of this, their healthcare has actual or potential legal implications. Trauma, violence, and maltreatment is very, very broad. And so forensic nurses can be trained to practice in that comprehensive, broad role, or they could subspecialize in a very specific, unique area of forensic nursing or a subspecialty. Sexual assault nurse examining, intimate partner violence, working as a death investigator, involving emergency preparedness or disaster management, or even correctional nursing, to name a few.
I have experience caring for patients throughout the lifespan who have been impacted by sexual and domestic violence. I practice as a forensic nurse specialist for the International Association of Forensic Nurses. In addition, I have experience as a forensic nurse educator and clinical consultant. Clinical consulting really came from just my experiences at OU and just my work experiences. I started to just get requests about program management, court testimony, and reviewing cases, specifically non-fatal strangulation cases, forensic nursing education and building curriculum, and really how we can advance the forensic nursing practice to be more equitable for patients, such as trainings on how to identify injuries in patients of color. So that's really where the clinical consultant came from, of just my experiences brought on so many different requests, and I really care about this population.
As a clinical risk specialist, I investigate the medical care into legal matters for the health system from both outside attorneys and government agencies. The forensic nurse practices at the intersection of healthcare and the legal system. As a clinical risk specialist, my role exemplifies both. This program has prepared me with both the confidence and the versatility to practice in both areas.
In my subspecialty of emergency medicine and correctional nursing, on a day-to-day basis, you're pretty much caring for the same kind of population, those underserved, those vulnerable populations. Emergency medicine really connected to correctional nursing in that it prepares you for what your patient looks like with limited resources in a correctional facility. So that definitely pairs with forensic nursing in dealing with those high acuity patients that you don't have resources to care for, and the vulnerable populations that we serve. My degree helped a step away from the bedside, from the ER to leadership in correctional nursing. It helps with policy and procedure placement, moving the department ahead when you're caring for special and vulnerable populations, and giving more empathy to those in need that are underserved so that you can better equip to medically take care of them.
I'm a clinical outcomes nurse specialist. That means that I'm able to help our care team deliver the best patient care with the best outcomes for our patients. I monitor quality metrics, I help track adverse events in our hospital, and develop policy and procedures that allow us to give patient-centered care with the highest quality. I chose the postgraduate certificate program in forensic nursing at Oakland University because of its reputation for high-quality programs. I also chose it because of its hybrid learning format, which allows for in-person and online class participation, and it caters to my learning style. The small class sizes are beneficial because you can get personalized attention, and it also allows us to have friendships develop from not only across our state, but across our whole country.
I chose OU because this program offered a hands-on approach to learning while also enabling me to grow as a distance learner. Throughout my time in this program, I've lived in Virginia, Florida, and Alaska now, and it's been smooth every step of the process. It's been through the ease of access to online course materials, along with the help of my clinical faculty in setting up local clinical placements where I live, which has been incredibly helpful.
Whether practicing comprehensively or in one of the subspecialty roles, these are all forensic nurses. And fortunately, the program here at Oakland University prepares our graduates in both ways to practice comprehensively or in one of the subspecialty areas. Importantly, graduates can take this education, move into a forensic nursing role, or they can use this education in their current practice, no matter the population of patient, the setting, or the level of care. The reason for this, and what we know, is that statistically, many people in society have experienced some form of trauma, violence, or maltreatment. From sexual violence to intimate partner violence or suffering an adverse childhood experience, all of these things are going to impact a person moving forward, including their ultimate health care.
I am a forensic nurse.
I'm a forensic nurse.
I am a forensic nurse.
I am a forensic nurse.
I am a forensic nurse.